Hey everyone, welcome to another episode of Living a Full Life. I'm Dr. Enrico Dolcecore. I'll be your host today. Today's topic, TMJ disorders, or just the TMJ in particular. The temporal mandibular joint is your jaw. And that's very well known in dentistry and in chiropractic care because of all the people that suffer with TMJ disorders, from teeth grinding to jaw pain to the endless things like the TMJ can bring, from neck stiffness to even headaches. The TMJ can be a culprit in a lot of these issues. And we're going to dissect this today and go through the most common reasons why people do end up with disorders of the TMJ and some things that we can do to help with it. So the temporal bone and mandibular bone meet right in the jaw, right at when you open your mouth as wide as you can, right in front of your ear on both sides, both ears. There is a TMJ joint, or temporal mandibular joint. This joint is a very unique joint. I mean, your mandible is very strong. If you look at the animal kingdom, we probably have one of the weakest strength jaws out there because we cook and process our food. So it's really easy. We've lost this over time. But if you look at all the other animals that have to crunch through other animal tissue and bone, their jaw power is unbelievable. And if you're a nerd like me, you go through the ranks of the animal kingdom from an alligator to a crocodile to a lion. And it's pretty amazing the strength and the PSI pressure you can get, or a hippopotamus. I mean, this stuff's so cool, and how much power the jaw can really have. So this is a very, very strong joint. Even in our life, think about how much you chew. Just the food that we normally eat. Some of us chew gum as well. You're just chewing all the time. I mean, that's a very strong joint that we have in the body, and it does some amazing things. It allows us to crush food and eat and all the important things. But the TMJ can also, if it doesn't function properly, can cause a lot of disorders. So a misalignment of the jaw or teeth is the number one reason why we may develop some type of TMJ disorders. This misalignment can result from genetics. It can be from a direct injury or a repetitive use injury, like chewing gum. I mean, that would be repetitive use, or even a developmental issue where the joint doesn't develop properly. And remember, we're very asymmetrical, just from left to right in the body and from north to south. Just if you look at your left hand and your right hand, it looks a little different, especially if you take an x ray. The joints don't always match up very similar. So that's why in our office, we take x-rays and even cone beam CTs to get 3D images of the spine and the joints we're looking at. And ever since we introduced the CBCT in our office for our upper cervical work, we get to see a lot of jaws, just like dentists. It's the exact same x-ray that they use to get a 3D image of the jaw. And we're getting very good at just assessing the jaw and working with dentists in the area to help our patients get to the results that they need. So a misalignment here is the first thing. And in chiropractic, we can adjust the TMJ directly. There's an adjustment for that. You can actually realign the TMJ joint. And then the most common disorders in the upper cervical spine, which we'll get to later. Let's keep our focus on the TMJ. Another thing is arthritis. The longer the process is there of dysfunction, the longer the inflammatory joint condition of the TMJ can turn into an arthritic change. It is a joint. It has this huge connective tissue between it, a ligament of the TMJ that opens and closes between every movement of talking, chewing, eating, and it's supposed to stay aligned between, like a cushion, like the meniscus in your knee. It's supposed to move very similar. And when this shifts or changes, it can become very painful because it affects the tissue around it. And if it gets inflamed, it becomes very painful in the area. Bruxism, or teeth grinding, is another persistent grinding that can strain the TMJ over time. Typically happens at night when we're sleeping, where we're grinding the teeth. And it's usually related to anxiety or stress, or just an abnormal bite. So getting that assessed is really important, and not waiting until the teeth start to grind and show where we need splints. It's trying to get to the root cause of why we're grinding and trying to fix the anxiety or the stress that's happening. Typically, it's neurological. All anxiety is neurological. So whenever we can address the neurological aspect of the stress, whether it's physical, chemical, and or emotional, then we can start to take the weight off of the grinding of the teeth, which is pretty amazing. And then, of course, direct trauma or injury right to the joint. Martial arts, boxing, hockey, football, all these things, basketball, soccer. How many times did I take a soccer ball off the face, right? These things can all happen and create and misalign the joint. This is the most common things that we see in our office. Simple adjustments, most people get better almost immediately with their TMJ. Genetics do play a role in this. Genetics play a role in everything. I mean, our genetics pretty much compose everything that we are made out of, and it's the blueprint to how we are going to be made up. So whenever our genetics are through our familial line, if we have some type of bone structure in the skull or overall bone structures around the world, you can see different types of skeletons and skeletal formations in our ancestors. Is that these things may fall around with us too, the round head or the square jaw or the square head or whatever it may be, or the long jaw. All these things can affect the TMJ and how it develops as well. And then teeth clenching is the same thing as bruxism. Bruxism is actually where we grind our teeth. Clenching is where we just keep that TMJ tissue tight all the time. And people usually hold their jaw. Most of these patients will end up having types of TMJ headaches. They'll get cluster headaches or side of the head headaches, or even tension headaches from keeping their teeth clenched all the time. So those are the most common things that happen with TMJ disorders. So the best thing to do is, how do we prevent them from escalating, from getting worse, or how do we even solve some of these things? And I've got 8 great tips when it comes to preventing TMJ disorders. One is maintaining good posture. So posture of the upper neck and the spine is so important. So our desk ergonomics, our computer setups, the way we use our phones and our hands and our tablets and our screens plays a huge role in our overall posture. Poor posture can contribute to jaw misalignments. So being mindful of how you hold your head and your neck throughout the day can be a huge benefit to how you function. So really important. And number one, and I put that number one on my list, is the good posture. Relaxation techniques like managing stress through deep breathing, meditation, yoga, stress reduction always helps with any type of tension, especially with teeth grinding. So, relaxation techniques to the stress in our lives. So, if you're an adult that has TMJ that's been an onset that's new in your life and you didn't have it as a kid, any TMJ disorders as a kid, and they came up later in life, you can almost always attribute it to stress, repetitive use at work, repetitive work. And these things start to get to us. And we get neck tension, turns to headaches. And then it eventually becomes a jaw issue where people are like, oh, my jaw just started to hurt. But every time I do a history with these patients, the headaches go for years back. And the neck tension will go back to maybe college days or high school days. And they're like, yeah, I used to have a stiff neck back then. And they didn't notice it. But then you get into teeth and dental questions. And then they start telling you, yes, they did grind a lot. Yes, they had dentures, or not dentures, braces, or Invisalign, or mouth palate expanders, or headgear, whatever it may be. And all these forceful changes of the mouth and the teeth can actually put stress on the TMJ as well. So then we can reverse engineer that and help them reduce stress, and use massage techniques and chiropractic techniques, or even acupuncture, to help decrease the actual stress in the jaw. When we do get inflamed, we want to minimize habits like chewing gum or biting on hard objects. These can limit or minimize a little bit of the strain on the TMJ joint. The TMJ, avoid excessive jaw movement, is this rule here, is number 3. And then we can start to get into gentle jaw exercises. Performing these exercises that are recommended by a physical therapist or your chiropractor or your dentist can improve jaw mobility and reduce the tension in there as well. So many small muscles in the jaw that make up our face, from the facial muscles to the pterygoid to the temporal to all these muscles that are in there. We can actually use techniques of trigger point, massage pressure techniques, light pressure techniques, deep pressure techniques to help release those small muscles that may be causing TMJ inflammation. We also go to a balanced diet here as well. Eating an overall balanced diet helps with TMJ issues, because any type of deficiencies can contribute to tightness, muscle tightness. And if the muscle tightness starts to affect the face, pretty easy to get the TMJ involved with all this. Then we can get into these custom mouth guards that are unique, and most dentists will be able to help you with this. If you grind your teeth, you need to wear a custom fitted mouth guard to protect the teeth. That's why we do this. However, it's a double-edged sword, because once you put in a piece of plastic into your mouth, you're changing the opening of the mouth. Now the jaw has to stay a little bit wider at night and stay open a little bit wider, which can also cause more TMJ issues. So this is something that has to be obtained through a dentist and checked back and forth to make sure that it's fitting you properly and not leaving you with any tightness in the mouth. Unfortunately, for some patients, we have to limit caffeine and stimulants that they may be taking, especially like coffee, because that can amp up their stress too. So sometimes I've had success with tough cases to start eliminating caffeine, looking at their diet, and doing the myofascial work on their mouth. That trio is where we start to put things at bay, and they end up realizing that the stress level of their life was pretty high and they were coping with certain lack of foods, to be honest with you, lack of nutrients, and over stimulating themselves with coffee and or caffeine. And that's typically the negative cycle that ends up doing that, and it's through that we end up helping them with that. So hydration as well plays a huge role. Just like any muscle in the body, we have to stay properly hydrated. So those are the things that we can do to help prevent TMJ from ever happening, or to help from TMJ disorders from getting worse. Okay. Teeth grinding is usually a direct relation to stress and anxiety. Emotional stress and anxiety are common contributors to people who grind their teeth. We see this in young kids as well at night. Something, if you're a parent, you've ever slept with your children, 2, 3, 4 years old, and they grind the teeth and they make that weird, like they're honestly sounding like they're going to crush their teeth. That's a unique thing. That's usually some type of deficiency that's going on. Whole Foods will solve this. You just have to change it up their diet a little bit, give them a whole different array of fruits and vegetables, and they typically change quite quickly. They will talk to you very quickly as far as deficiencies with little things like that happen through the nervous system at night. Night is an interesting thing with pediatrics, but with adults, it's usually your spouse or someone else that tells you, dude, you're grinding your teeth. What is going on? And it's usually related to stress and anxiety. A misaligned bite or a malocclusion and a normal bite can usually lead to teeth grinding as well. This is where we have just a mismatch of the upper and lower teeth that cause, the teeth to grind just by eating or chewing. And this again is a dental thing that we have to go and get assessed properly through dentists. Sleep disorders like sleep apnea or snoring can be associated with teeth grinding as well. So that just that tension of the mouth and throat can actually cause snoring effects too, and lifestyle factors as well. Excessive alcohol consumption, smoking, recreational drug use, that stuff can all lead to that type of pattern of grinding our teeth, and that is a neurological um, compensation that happens when we start to stress out that entire system. So, stress management is usually the best way to help any type of tension in the body, especially if we're grinding our teeth or causing any type of TMJ stress. Using oral devices by a dentist and following the recommendation is sometimes needed and should be assessed for. Limit stimulants. That's usually a good start. It's almost like a detox when we limit these stimulants, gives our body a chance to just relax from the constant brigade of overstimulation from caffeine or whatever it is we use to keep our energy up. It usually keeps us tense as well. Uh, Exercising can help that too because it decreases overall stress on the muscles. And then maintaining good sleep hygiene, just having a regular pattern to your sleep. If you're going to go to bed at night, make sure it's always at 10, whatever it is, 9, 10, 11 o'clock, and just waking up around the same time. So your body's always getting that 7-hour sleep cycle, 8-hour sleep cycle. That is important. It's all about routine. Alcohol and tobacco use, of course, stresses this whole thing out as well. And just making sure you do your regular dental checkups. This is how you can catch things in a timely manner. Sometimes you don't even know you're grinding. The dentist will ask you, hey, this looks a little more abrasive than last year. Um, are you grinding your teeth? And you'd be like, I don't know. And they'll quickly check it out and they'll be like, I think you are. Here's a little mouth guard or a splint to help prevent the teeth from grinding down. Let's recheck again in 6 months. So it's really essential to use your healthcare team properly to maintain this specific area of the body. The TMJ is such a unique one. It's also a very stubborn area anatomically, just because of how it's made. It's just a very difficult joint to work with. It's a very difficult joint to diagnose, but it's so important with everything that we do, from chewing and everything from a day-to-day basis. So really important there. This was a unique one. If you have any TMJ questions, I highly recommend sending them my way. I have a great network of dentists across the country that I work with for very specific conditions, from splinting, alignment, myofascial release, tongue ties, buccal ties, speech pathology, sleep apnea, improving sleep, even stress. I mean, all these dentists try and focus in a particular specialty when it comes to certain things that I've learned so much from them. And we work hand in hand with the upper cervical spine that we do with chiropractic and the TMJ with both chiropractic and dentistry. There's a great overlap in what we do. So if you have questions, I've got some great people I can resource out to you and answer some of the questions you may have there. I love those ones. That's one of my wheelhouses that I truly enjoy is the upper cervical spine, TMJ, the occiput and the skull, craniosacral work. That stuff is a unique pattern and can array a lot of things from the body and tell us a lot of things about where stresses are being kept, what's happening. I can never figure out what's stressing you out. That's where I need your help as a patient is when we go through that history, being detailed and sharing that information with your providers helps pinpoint where a lot of the stresses may be coming from. And then we can reverse engineer and help you get better. So if you know anyone with TMJ, I highly recommend upper cervical chiropractic care. I highly recommend a good dentist that's well versed in TMJ disorders. And then you're off to a great start for your healthcare. Have a great week. Stay well. Take care of that oral hygiene and stay vital.